Question 41. The nurse in chart measures a patient's temperature at 102 degrees F. What is the equivalent centigrade temperature? A. 39 degrees C, B. 47 degrees C, 38.9 degrees C, D. 40.1 degrees C. Answer C. Explanation. To convert Fahrenheit degrees to centigrade, use this formula. C degrees equals F degrees minus 32, multiplying 5 per 9. C degrees equals 102 minus 32, 5 and 9, plus 70 multiplying 5 per 9, 38.9 degrees C. Question 42. To evaluate a patient for hypoxia, the physician is most likely to order which laboratory test? A. Red blood cell count, B. Sputum counter, C. Total hemoglobin, D. Arterial blood gas (ABG) analysis. Answer D. Explanation. All of these tests helped evaluate a patient with respiratory problems. However, ABG analysis is the only test evaluates gas exchange in the lungs, providing information about patient's oxygenation status. Question 43. The nurse uses a stethoscope to auscultate a male patient's chest. Which statement about a stethoscope with a bell and diaphragm is true? A. The bell detects high-pitched sounds best. B. The diaphragm detects high-pitched sound best. C. The bell detects thrills best. D. The diaphragm detects low-pitched sounds best. Answer B. Explanation. The diaphragm of a stethoscope detects high-pitched sound best. The bell detects low-pitched sounds best. Palpation detects thrills best. Question 44. A male patient is to be discharged with a prescription for an analgesic that is a controlled substance. During discharge teaching, the nurse should explain that the patient must fill this prescription how soon after the date on which it was written. A. Within 1 month, B. Within 3 months, C. Within 6 months, D. Within 12 months. Answer C. Explanation. In most cases, an outpatient must fill a prescription for a controlled substance within 6 months of the date on which the prescription was written. Question 45. Which human element considered by the nurse in charge during assessment can affect drug administration? A. The patient's ability to recover. B. The patient's occupational hazards. C. The patient's socio-economic status. D. The patient's cognitive abilities. Answer D. The patient's cognitive abilities. Explanation. The nurse must consider the patient's cognitive abilities to understand drug instructions. If not, the nurse must find a family member or significant other to take on the responsibility of administering medications in the home setting. The patient's ability to recover, occupational hazards, and socio-economic status do not affect drug administration. Question 46. An employer establishes a physical exercise area in the workplace and encourages all employees to use it. This is an example of which level of health promotion? A. Primary prevention, B. Secondary prevention. C. Tertiary prevention. D. Passive prevention. A. Explanation. Primary prevention precedes disease and applies to health patients. Secondary prevention focuses on patients who have health problems and are at risk for developing complications. Tertiary prevention enables patients to gain health from others' activities without doing anything themselves. Question 47. What does the nurse in charge do when making a surgical bed? A. Lifts the bed in the high position when finished. B. Places the pillow at the head of the bed. C. Rolls the patient to the far side of the bed. D. Tucks the top sheet and blanket under the bottom of the bed. Answer A. Explanation. When making a surgical bed, the nurse leaves the bed in the high position when finished. After placing the top linens on the bed without pouching them, the nurse then folds these linens to the side opposite from where the patient will enter and places the pillow on the bedside chair. All these actions promote transfer of the post-operative patient from the stretcher to the bed. When making occupied bed or unoccupied bed, the nurse places the pillow at the head of the bed and tucks the top sheet and blanket under the bottom of the bed. When making an unoccupied bed, the nurse rolls the patient to the far side of the bed. Question 48. The physician prescribes 250 milligrams of a drug. The drug vial reads 500 milligrams per milliliters. How much of the drug should the nurse give? A. 2 millimeters. B. 1 millimeter. C. 1.5 millimeters. D. 1.4 millimeter. Answer C. Half millimeter. Explanation. The nurse should give half millimeter of the drug. The dosage is calculated as follows. 250 milligrams per x equals 500 milligrams per 1 millimeters. 500 x equals 250. X equals half millimeter. Question 49. Nurse Mackey is monitoring a patient for adverse reactions during barbiturate therapy. What is the major disadvantage of barbiturate use? A. Prolonged half-life. B. Poor absorption. C. Potential for drug dependence. D. Potential for hepatotoxicity. Answer C. Explanation. Patients can become dependent on barbiturates, especially with prolonged use. Because of the rapid distribution of some barbiturates, no correlation exists between duration of action and half-life. Barbiturates are absorbed well and do not cause hepatotoxicity. Although existing hepatic damage does require cautions, use of the drug because barbiturates are metabolized in the liver. Question 50. Which nursing action is essential when providing continuous enteral feeding? A. Elevating the head of the bed. B. Positioning the patient on the left side. C. Warming the formula before administering it. D. Hanging a full day's worth of formula at one time. Answer A. Explanation. Elevating the head of the bed. Explanation. Elevating the head of the bed during enteral feeding minimizes the risk of aspiration and allows the formula to flow in the patient's intestines. When such elevation is contraindicated, the patient should be positioned on the right side. The nurse should give enteral feeding at room temperature to minimize GI distress. To limit microbial growth, the nurse should handle only the amount of formula that can be infused in 3 hours. Thank you for watching.